Have you ever wondered what it's like for LGBTQ patients in need of health care that experience sexual discrimination? These are vulnerable patients, and they experience health disparities. Health disparities are differences in health between different groups of people. LGBTQ patients experience a number of health disparities. They're at higher risk of certain conditions, have less access to health care, and have worse health outcomes. These disparities are seen in the areas of behavioral health, physical health, and access to care because of sex discrimination. The hate felt by them is internalized, leading to victimization, decreased psychological health, increased harmful behaviors such as substance abuse with drugs, alcohol, and tobacco, eating disorders, reduced relationship quality, ineffective coping, and lower levels of self-esteem. These vulnerable patients are at greater risk for certain conditions, diseases, and infections. HIV, HPV, cervical or anal cancers. They rate their health as poor and report more chronic conditions while having less social support. Lesbian and bisexual women experience higher rates of obesity and breast cancer. With 2.7 million U.S. adults self-identifying as a member of the LGBTQ community, many of them felt unsafe sharing their sexual orientation, and many report that they're not out to their provider. Many older LGBT adults navigate social situations carefully to avoid negative experiences. LGBTQ athletes experience sexual prejudice, and after coming out to their family, there was an increased incidence in coming out to their sports family. The support that they had from their family increased the incidence of sharing their LGBTQ status. Transgender patients experience discrimination, prejudice, and bias at even higher reported levels. This internalized stigma and discrimination leads to unmet needs because of healthcare avoidance. Unconscious bias by healthcare providers has an impact on the clinical encounter, which can threaten the shared decision-making and perpetuate health disparities among LGBTQ patients. Discussing gender and sexual orientation in the physician's office is beneficial in improving patient care as well as the perception of care. The fear in the aging population is real from the societal imposed stigmatization that lesbian and gay older adults experience. The fear is increased when thinking about needing a long-term care facility. Advances in civil rights with the federal recognition of same-sex marriage. Yet other civil protections such as rights in employment and housing are only extended to sexual minorities in some local jurisdictions and a limited number of states. The experience of discrimination, be it institutional or healthcare or interpersonal, it increases the body's stress response over time, and that discrimination is linked to a range of poor health-related behaviors and outcomes, including mortality. Change is needed. Healthcare providers need to be prepared to create trusting relationships with our LGBTQ members to provide comprehensive care and work to eliminate unmet needs. We need to ensure family and social support for essential well-being and inclusion. Cultural competence is needed to bridge the gap in care the LGBTQ community members experience at our hand. We need to recognize bias that results in injustice. Ensure appropriate time is allocated for supportive services in this vulnerable patient population. We need to make sure they feel valued and safe. We're in a unique position to enable these patients to flourish. The LGBTQ patient population is still vulnerable, and change is needed. It's time to care with pride.